Dr. Marcia Angell has been one of the foremost champions of a single-payer nationalized health system, a kind of Medicare for everyone. That was a plan favored by Barack Obama before he was president, but he backed off in the health care debate, saying it's just not viable in the current climate. You've seen Marcia Angell at this table before. A physician trained in both internal medicine and pathology, she was the first woman editor-in-chief of the New England Journal of Medicine. She's now senior lecturer in the Department of Social Medicine at Harvard University Medical School and writes extensively and often about health care. On her previous visit to the Journal last July, she had this to say.
I would rather see Obama go down fighting for something coherent and practical that the public could mobilize behind than go down fighting for this amorphous plan that tries to keep the private insurance industry in place.
Since then, health care reform has gone through more twists and turns than a mountain road. And Dr. Marcia Angell is back to tell us what she thinks now. Welcome to the Journal.
Thank you very much. It's
so,
good to be here.
Has President Obama been fighting as hard as you wished?
Fighting for the wrong things, and too little, too late. He gave away the store at the very beginning by compromising, not just compromising, but caving in to the commercial insurance industry and the pharmaceutical industry. And then he stood back for months while the thing just fell apart. Now he's fighting, but he's fighting for something that shouldn't pass, won't pass, and shouldn't pass. What this bill does is not only permit the commercial insurance industry to remain in place, but it actually expands and cements their position as the linchpin of healthcare reform. And these companies, they profit by denying health care, not providing health care. And they will be able to charge whatever they like. So if they're regulated in some way and it cuts into their profits, all they have to do is just raise their premiums. And they'll do that. Not only does it keep them in place, but it pours about $500 billion of public money into these companies over 10 years. And it mandates that people buy these companies' products for whatever they charge. Now, that's a recipe for the growth in healthcare costs not only to continue, but to skyrocket, to grow even faster.
But given that, why have the insurance companies, health insurance companies, been fighting reform so hard?
Oh, they haven't fought it very hard, Bill. They really haven't fought it very hard. What they're fighting for is the individual mandate. And if they get that mandate, if everyone does have to buy their commercial products, then they're going to be extremely happy with it.
But this is all about politics now. It's not about pure health care reform. So given that reality, what would you have the president do?
Well, I think you really do have to separate the policy analysis from the political analysis. And I'm looking at it as policy, and it fails as policy. Moreover, a lot of people say, let's hold our nose and pass it because it's a step in the right direction. And I say it's a step in the wrong direction. You're right, politics is different. And there are a lot of people who say, look, it's a terrible bill, even a step in the wrong direction as policy goes. But we need to get Obama elected again. And we need to continue with the Democratic majority in Congress. And so we need to give Obama and the Democrats a win. If we don't, the Republicans will come in and take over Congress in the fall, and then the White House in 2012. But the problem with a political analysis is sometimes you're right and sometimes you're wrong. And Democrats, and particularly liberals, have a history of outsmarting themselves. And I'm not so sure that if this bill goes down, it's going to make it any harder for them politically. So I think it's difficult times for the president and for the Democrats. But if you look at it as a matter of policy, the president's absolutely right that the status quo is awful. If we do nothing, costs will continue to go up, people will continue to lose their coverage, employers are dropping health benefits, things will get very bad. The issue is, will this bill make them better or worse? And I believe it will make it worse.
The President, with all due respect, would disagree with you. Let me show you something he said in his speech on Wednesday.
Yes.
My proposal would bring down the cost of health care for millions, families, businesses, and the federal government. Our cost-cutting measures mirror most of the proposals in the current Senate bill, which reduces most people's premiums and brings down our deficit by up to $1 trillion over the next 2 decades. Brings down our deficit. Those aren't my numbers. Those are the savings determined by the Congressional Budget Office, which is the Washington acronym for the Nonpartisan Independent Referee of Congress.
Not good enough for you?
Well, first of all, you have to look at what the CBO is looking at.
Congressional Budget Office.
Yes. They're not looking at the cost to the system as a whole, to the larger system. They're not looking at the private system. They're simply looking at the federal budget as a budgetary item.
They look at the government.
The government part of that. So if they can save money in Medicare, then they come out ahead, no matter what happens out in the private sector. And so that's what he's talking about. It will take money out of Medicare and put it into the private sector. Medicare is the source for a lot of the funds that are going to go to subsidize the private health insurance industry. So that's the first thing.
Right.
The second thing is the CBO has to build in assumptions, and those assumptions are arguable, to put it mildly. And as far as cost cutting, there are sort of promissory notes. We'll get a committee to look at the cost effectiveness of various medical procedures.
Well, you remind me, 45,000 people, as Wendell Pollard said earlier, die every year for lack of health insurance. That should be it.
No, it's not lack of health insurance. It's lack of health care. There is a difference between health insurance and health care. You can have insurance offered that is too expensive to buy or too expensive to use. What good does it do? And what happens when this occurs is that what you see is, instead of improvements, look at my state of Massachusetts, instead of seeing improvements, you see it shredded even further. You see more people denied access anyway. Now there are about, I think, over 60,000 people in my state who are exempted from the plan for financial hardship. And this is also in the Obama plan. If you're really poor, you don't have to participate. And these are the very people who should be in a plan to cover them.